Are your eyes bothering you? Not just the occasional dryness or redness, but regular discomfort and irritation that can get in the way of living your normal life? You may have meibomian gland dysfunction or evaporative dry eye. Think about the treatments you've tried in the past to get some relief. And think about the compromises you have to make every day and the lifestyle issues you face. Maybe you can't wear contact lenses or have to limit your computer time. Even just reading a book or enjoying a breezy spring day may be out of the question. Does any of this sound familiar? If so, you should know that eye experts have recently made great strides in understanding evaporative dry eye. And with the introduction of the breakthrough technology in the Lipiflow system, your doctor can now treat a leading cause of dry eye, in most cases making the discomfort, inconvenience, and limitations of evaporative dry eye a thing of the past. Your tears are made up of 3 layers: the mucin layer that adheres to the eye, the aqueous or water layer, and the lipid or oil layer, which lubricates and prevents evaporation. The lipid layer is created by meibomian glands in the eyelid. When you blink, pressure is put on the glands and lipids are released. New technology allows your doctor to view the tear film, seen as a dynamic color pattern on the surface of the eye. The Lipiview takes detailed images of your tear film during a non-invasive in-office exam. Until now, much of the focus of dry eye treatment has been on supplementing the tear film with the use of drops and ointments. However, 65% of patients with dry eye symptoms actually suffer from evaporative dry eye, a real disease that could worsen if left untreated. Evaporative dry eye disease is most often caused by meibomian gland dysfunction, a blockage or obstruction in the meibomian glands, which can lead to a lipid deficiency in the tears. This blockage causes symptoms such as watering, gritty feeling in eyes, and itching. If left untreated, blocked glands can stop functioning altogether. With the breakthrough Lipiflow system, your doctor now has a new way to treat the cause of meibomian gland dysfunction, or evaporative dry eye. Examination of the meibomian gland openings in your eyelid will help your doctor to determine if you are a good candidate for the Lipiflow treatment. If so, you can take advantage of this technology by receiving treatment right in your doctor's office. In a clinical study, an improvement on average in the gland secretion and dry eye symptoms was observed at both 2 and 4 weeks after a single Lipiflow treatment. Unlike warm compresses, the Lipiflow system applies a combination of heat from the inside of the lid, near the meibomian glands, and gentle pressure on the outside of the lid. This precise combination of heat and pressure is designed to liquefy and remove blockages in the glands, which may improve dry eye symptoms. In a clinical study at 4 weeks after treatment, 79% of patients reported improvement in dry eye symptoms.
My eyes were an increasing problem for me that was handicapping me to just actually enjoy life, because my whole head was involved in this heavy, aching feeling that I had. There are days I go by, I don't need my eye drops, but there are days when my head feels absolutely normal. It's a matter of reclaiming hours of my life.
I work in insurance sales, and I would have to do client visits in which I would have to present a illustration system to them and teach them how to do it. Walking into someone's office and looking red and irritated and not healthy wasn't the best thing for my career. I also, just driving home from work after being in an office all day and having to come out into the light, it would burn to the point where I couldn't go anywhere without sunglasses. I was tearing constantly. I couldn't wear my contacts. So now I'm back to being active. I can run, I can bike ride, I have a 8-year-old now. I can do all the things that I want to do with him, go to amusement parks and water parks and all that other stuff. I couldn't do a lot of that before. So I'm able to do client visits, I can wear makeup, it's changed my life, it really has.